The Pima County Health Department is out with a warning tonight about measles as Texas sees its first death from the highly contagious disease. Health workers say a child who was not vaccinated died in the town of Lubbock. They say the child was school aged and was hospitalized last week. This is the first death from measles in the U.S. since 2015. Cases have been detected in 8 states, including neighboring New Mexico and Texas. So far, there are no reported cases here in Arizona. I asked Pima County health officials about their concerns here as they see a decline in child vaccination rates.
Measles is a highly contagious disease, so yes, we are concerned.
The Pima County Health Department is keeping a very close watch as measles cases increase by the day in neighboring Texas and New Mexico.
I can only assume that we might be underestimating the number of cases in the outbreaks in Texas and New Mexico, because not everybody is sick enough to go to the hospital, so they may not be getting tested.
Common symptoms are rash, fever, cough, runny nose, and red eyes.
Some people will recover just fine. But 20 to 25% of people that get measles will end up hospitalized.
Lindsay Kohler, epidemiology division manager for the health department, says vaccination rates play a huge role in preventing the spread.
In the last 10 years, we've only had 1 case of measles here. And so our vaccination rates are pretty good, but they have been declining over the last few years.
The measles, mumps, and rubella, or MMR vaccine, is the best protection against measles. Kohler says people typically get their first dose of the vaccine when they are between 12 and 15 months of age. The second dose is administered between 4 and 6 years of age. The health department says MMR vaccination rates at 95% among the kindergarten population is a metric they aim to achieve. Right now, they are at 93.7%. The MMR vaccine is a requirement to attend Arizona schools per state law unless a personal belief exemption form is submitted to the school. Kohler says lower vaccination rates are due to an increased number of parents requesting personal exemption belief forms. With most adults being vaccinated or having already had measles, Kohler says
the focus is mostly on kids right now. It's mostly in unvaccinated kids,
including infants who are too young to get the shot.
That's why we are really concerned about babies, because they're not eligible to get MMR.
The take-home message for everyone: vaccination is the best defense against measles. Ashley Bowerman, 13 News. And Kohler adds that if there is community-wide transmission affecting young infants, health departments may recommend an early dose for infants 6 to 11 months of age.